lower left, first and second molars. And in this case, we use a guide to create bleeding points by putting a perio probe through these holes. And again, it's the same principle as we described before. We're defining the trajectory sequentially instead of all at once with a tube. So you have your bleeding points here and here. We use these spear drills for our pilot holes. They're very accurate. They go right through the bleeding point. They don't slip laterally. They just lock onto wherever you put them. You can see the entry points here. We drill pilot holes. Here you can see the pilot hole, 2 millimeter diameter pilot hole. The flap has been reflected. Here are some guide pins to show you trajectories and spacing. The guide is in place. You can see that the osteotomies are in line with the guide holes. Same thing when you put pins in them. You can see how things are centered. Here are the final osteotomies. We're using the cortical drill or the countersink through the guide centered. We're placing the implant through the guide with the driver centered in the guide hole. And here you have placement of your implants. Again, ideal situation for the restorative doc.